gotten to meet a lot of you over the last 4 years since I came to San Jose from Seattle. My name is James Crew. I'm one of the doctors on the Spinal Cord Unit at the Santa Clara Valley Medical Center. I work a little bit in the clinic, a little bit on consults. So if you've been injured and been through there in the last 4 years, you've probably seen me at some point. So I talked last year on vitamin D because it's something that I've done some research on. I'm going to touch on our updated research today because I think it ties in with this topic. When I asked Robert what he wanted me to kind of cover today, he mentioned health and wellness. So I'm going to talk a lot about nutrition in this talk. Some of it is specific to spinal cord injury. A lot of it is more relevant to just being an adult in the United States. So the objectives for my talk, I'm going to touch on some cardiovascular risk and typical abnormalities following spinal cord injury. Sorry for the misspelling there. I'm going to discuss nutrition and exercise with specific focus on spinal cord injury, and also touch on some recommendations for nutrition and exercise, as well as some options. It's obviously more challenging to get aerobic and anaerobic exercise when you're in a wheelchair, but there are some things that many of you probably already know about, some things that maybe you don't, that I'm going to try to get into during the next 45 minutes. I'm also going to review some recent research that we've been doing at Santa Clara Valley after spinal cord injury as it pertains to wellness. So I would say maybe if we can hold questions till the end, if something's really burning, feel free to raise your hand. Otherwise, I kind of want to get through most of the content. If I see people getting really bored, I'll kind of stop and see if we need a break. So just kind of looking at, I hate to start off with death, morbid topic, but looking at what conditions tend to lead to death after spinal cord injury. It's not that different than the general population. The big difference is respiratory disorders. This kind of top segment here is most common. So pneumonia, if you look at any problem after spinal cord injury, is the #1 cause of death. And that's if you survive the first year after spinal cord injury. There's some acute problems with infections and other things that can lead to death after trauma or non-traumatic, depending on what the etiology is. If you look at the next two segments, these are actually both heart disease. And the way the model systems defines cardiac disease is a little odd. Some of these patients, on autopsy, they weren't sure, so they just chalked it up to heart disease. Newer studies and kind of other studies outside of the model systems have suggested that coronary artery disease or heart disease is actually as much of a problem in the spinal cord population, or even more of a problem in the spinal cord population than the general population. So, can you hear me at all? Or? No, we're good. You're good. Okay. So, metabolic syndrome, I don't know, have you guys heard that phrase before? Does that sort of ring a bell with people? So what that has to do with is this syndrome where patients tend to get, adults in the United States specifically in developed countries, tend to get obese. They tend to have high cholesterol or dyslipidemia. They tend to develop hypertension or high blood pressure and hyperglycemia. These problems are especially common in spinal cord injury, as is obesity. So dyslipidemia encompasses everything from high bad cholesterol to low good cholesterol to high fatty acids. The problem in spinal cord injury is typically actually low good cholesterol. The target actually for women has been up, so good cholesterol needs to be higher in women to decrease risk of coronary artery disease, and that includes those who have spinal cord injuries. So looking at specific research, Dave Gator is a spinal cord injury physician in Virginia at the VA in Richmond. He's done a lot of research on metabolic problems after spinal cord injury. And what he's found in looking at almost 500 patients is that the majority of patients had body mass index over 25, which is considered obese. So majority of patients were obese. This is a cohort of patients in a chronic VA. So they're anywhere from like 5 to 15 years out from injury. Majority of patients actually had low good cholesterol. This number should actually be high. We want that HDL over 40 in all adults. About 50% had fasting blood glucose or blood sugar levels that were high, so they're pre-diabetic. So these two conditions, these three are actually very common in spinal cord injury, sort of notorious. After spinal cord injury, you have low good cholesterol, you have higher body mass index, you have less muscle mass, you have higher body fat composition, and then majority of patients actually have, probably if you ever worked with me, I talk about the fact you're not going to get high blood pressure unless you have autonomic dysreflexia. You tend to have lower blood pressure at rest. But actually in the chronic population, particularly if you have paraplegia or injuries in your thoracic or lumbar spine, you can actually get resting blood pressures, the top number systolic over 130, the bottom number potentially over 80. That would qualify you for hypertension. So majority of patients really have these problems that go under the category of metabolic syndrome. This puts you at high risk for stroke, coronary artery disease, and other health disorders. So we kind of look at the general population. The spinal cord population was actually 50% higher, 45% spinal cord versus 30% in the general U.S. population. So why is it such a problem in the United States? Well, if you go outside Valley, what do you see? You go across Bascom, you see Wendy's, Taco Bell, and McDonald's. They're all right there. So not uncommon, you're driving down the highway, you see lots of options for fast food. People are busy, they're working, they have a half hour for lunch. What are they going to do? They're going to get foods that have high calories, that give them energy, and they can get in and out quick, and they're also cheap. So looking at dollars, you know, it has been thought in the past that fast food is the way to go. If you don't have a lot of money, you can get a lot of nutrition, a lot of calories for your money. However, there's bad outcomes in terms of potential health risks long term if you eat fast food. We're going to talk more about that. Obesity, central obesity has been looked at as the predominant problem. Kind of thinking about calories in, calories out. So obviously if you eat a lot and your metabolism is slow and you're not able to exercise a lot, which can be the problem after spinal cord injury, it's harder to get your heart rate up. We're going to talk about exercise towards the end of the talk, but calories in and calories out, essentially energy in and energy out, need to be equivalent. If there's an imbalance, obviously you can lose weight if you're exercising a lot, or if you're not eating a lot. If you're eating too much and not exercising enough, obviously you're going to gain weight. So if you smoke, quitting smoking will increase your good cholesterol by 10%. Diet, we're going to talk a lot about. Exercise, I'm going to talk about towards the end. Medications, there's certain medications. Now you hear a lot about Lipitor or Zocor. You hear about those in the news or on TV. They're very commonly used medicines called statins. Those medicines actually aren't necessarily that effective for the type of cholesterol problems that spinal cord patients tend to have. So most commonly what you have after spinal cord injury is low HDL, the good cholesterol that tends to be boosted by exercise, and you have higher fatty acids. So there's different medications, including niacin and gemprebrazole, which typically we can put people on after spinal cord injury if they have these problems. Question now? I can, yeah. So we'll get to that. I think it's in a couple slides. Yeah. Yeah. So I went through this slide a little quickly, so to back up. Central obesity has to do with abdominal circumference. So rather than just looking at body mass index, another marker of obesity is actually looking at waist or abdominal girth circumference. So if it's greater than 102 centimeters in men or over 88 centimeters in women, that's analogous to obesity by body mass index. I was just at the American Spinal Injury Association annual meeting in Chicago, and there was a push now to look at abdominal circumference rather than body mass index. However, there isn't clear evidence yet in the literature to say that we need to use one or the other. I can tell you that a lot of centers throughout the country looking at spinal cord injury are starting to use this rather than BMI. Yeah. So moving on to, I just want to talk about sleep briefly because I think that has gained a lot of attention, as has stress. Hi, Anne-Marie. We're not going to be able to get into everything during this talk, but I do want to talk a little bit about sleep disordered breathing. Let's see here. Sorry. So let me go to this slide first, because in general, what's recommended is 7 to 9 hours on average of sleep every night. Who in here gets 7 to 9 hours of sleep a night? So 1, 2, 3. That's pretty good. I know I don't with a 1-year-old baby at home. So it's hard to get that. However, really inadequate sleep can impair your cognition, your thinking, your alertness, your attention. It can also lead to you being high risk to develop diabetes, coronary artery disease or cardiovascular disease, obesity, depression. And they've also looked recently, and this is coming out of the American Heart Association. This is coming from Stanford studies, actually in public health recently, showing that they looked at patients who were sleep deprived and what they chose to eat. And they actually chose to eat very bad things, processed foods, fast foods, meals with very quick caloric intake that could give them some energy. But again, we're going to talk about how those foods can lead to some bad outcomes. So sleep is important, and it's kind of this vicious cycle of not getting enough sleep leads to obesity, leads to choosing bad foods to eat, and leads to you being high risk to develop heart disease and abnormal blood pressure, elevated blood pressure, abnormal cholesterol. So nutrition. Have you guys heard of the terms macronutrients and micronutrients lately? This has got a lot of press over like the last 5 to 10 years. We're going to talk about those a bit. So basically, this is a hint at what I'm going to get towards, which is veggies. Fruits and veggies are really important. We're going to talk about plant-based diets a bit, but balance is key. You need to have both macronutrients. So we've all heard you need a balanced diet. There's different food groups. That's kind of being challenged lately in the way we used to think about food groups in terms of breads, dairies, fats, proteins. Really, this breakdown should be fairly equivalent. Now what's being recommended, though, is less than 25% of your calories should come from fat. And there should be a pretty equal split between the rest of your 75% of calories between carbohydrates and protein. It depends on where you're at after injury. If you've just had a spinal cord injury, you're in a net negative balance. And what that means is your body is inflamed. It's requiring a lot of calories to keep up. You're losing muscle mass. So we put those patients on a typically higher protein diet to try to maintain their muscle mass as much as we can. But in a steady state, after several months after the injury, you need to be on a lower protein diet, definitely a lower carbohydrate diet, and the fats we'll get into, but shouldn't be more than 25% of your total caloric intake. Micronutrients, vitamins, I'm going to talk a bit about vitamin D and some other vitamins that are known to be sort of lacking in the typical U.S. diet, as well as minerals. So what is the sort of recommendation now? Let me back up to sleep disordered breathing. Sorry, I got a little off track there. So before we jump back to nutrition, I want to talk quickly about sleep disordered breathing. So I said 7 to 9 hours is what you need every night. Patients after spinal cord injury, higher risk to develop either central or obstructive sleep apnea. Central sleep apnea has to do with neural connections from the brain to the brainstem to the spinal cord that help control our breathing patterns at nighttime. They can be disrupted after stroke, after brain injury, and definitely after spinal cord injury, particularly in the cervical spine or the neck. Obstructive sleep apnea has to do with the fact, you can develop this if you're overweight or if you just have a really thick muscular neck. If you're laying particularly on your back at night, there's too much weight on the windpipe and you tend to snore really loudly. At times you lose airflow to your lungs and you wake up apneic or not breathing. So these are common problems in the general population, but even more common in those who have had spinal cord injuries. So symptoms of this include snoring, daytime sleepiness. Morning headaches is really common, and we don't tend to ask about that enough as physicians and as providers. So if you recognize some of these symptoms, this may be one thing having to do with why you might feel more sleepy during the daytime. It can also lead to cognitive impairment, particularly common after tetraplegia or cervical spinal cord injury. 80% or more have some type of sleep disordered breathing or sleep apnea at 3 months after injury. Increased neck circumference and also increased abdominal girth, I touched on that earlier, leads to being higher risk. Benzo medications include Valium, Ativan, Klonopin. Those can all lead to you being higher risk to develop sleep disordered breathing. Multiple problems with sleep disordered breathing. It decreases your quality of life. You're more fatigued during the daytime. You're waking your partner up at nighttime if you sleep in bed with them because you're snoring so loudly. The machines have actually gotten better and they're more quiet and better tolerated. This was an ad I just found on Google. Actually, they're advertising and marketing sort of tailored headbands and tailored masks, and you can sort of design your own. But this is a nasal mask that goes over the nose and keeps a positive pressure through the airway. So it essentially always gives you a little pressure down your airway so that your lungs can stay open and you can get more oxygen flow to your lungs. And you get better oxygenation throughout the nighttime, leading to better thinking and also decreased rate of several problems. We know that sleep disordered breathing long-term can lead to heart disease, stroke, atrial fibrillation, which is an abnormal heart rhythm that tends to significantly increase stroke risk, and also heart failure. It leads to increased pressures in the right heart, which can lead to back pressure in the lungs and can cause heart failure inevitably. So treatments for this are essentially weight loss or the use of one of these devices or both. So I went through that and I talked a little bit about macro and micronutrients. What I really didn't get to is I'm going to talk a little bit about good versus bad fats and also glycemic index. So this is actually new. I just found this article. Actually, my wife, she works in public health at Stanford, and this actually came out. So this is from the Permanente Journal, which is essentially the journal for all Kaiser physicians. It's available to the general, public. But essentially, what this article did is it found that plant-based diets, so eating majority of your calories from fruits, vegetables, whole foods, not baking, frying, or eating a lot of extra meat or dairy or processed foods. Processed foods, think of anything you get out of a bag or a box or that's frozen in the grocery store. Essentially, all those foods are processed. So avoiding those foods as much as you can, eating a lot of fruits and vegetables, they found that they could improve diabetic control in a patient with diabetes by 100%. So they brought the patient's blood sugar level down from a hemoglobin A1C of 12 down to below 6, which is actually normal, something that anyone would have. So they were able to control a severe diabetic with plant-based diet that they couldn't control with medications alone. So essentially, based on that and some other research, they're recommending right here, you don't have to read the whole thing, but research shows that plant-based diets are cost-effective, low-risk interventions that may lower body mass index, which is improve obesity, may improve blood pressure, may improve hemoglobin A1C, which is our marker for diabetes, and also improve cholesterol levels. They also may reduce the number of medications needed to treat chronic diseases, lower ischemic heart disease, which is the type of heart disease that leads to stroke and heart attacks, and also may decrease mortality or death rates. So what they're recommending here, and this is, journals don't tend to be very strong with their language, but their last sentence is, I think, something that's pretty impressive. They say, physicians should consider recommending a plant-based diet to all their patients, especially those with high blood pressure, diabetes, cardiovascular disease, and obesity. So that's a pretty strong guideline and a strong recommendation to be considering this rather than using more and more medications that may not be as efficacious or as good as plant-based diet. So what is a plant-based diet? Have you heard of superfoods? Have you guys run across this? So this has got a lot of press. This is actually written, believe it or not, by Dr. Stephen Pratt, who's a private, I think he's a private ophthalmologist in San Diego. So he's not like necessarily someone who you would think would be an expert in nutrition. And when he wrote this book, it got challenged a lot. I think it was a few years ago, challenged a lot by nutritionists throughout the country saying, there's hardly enough evidence behind this, but really over time it's become more and more accepted that this idea at least is maybe the way to go. And this is sort of the foundation for a lot of plant-based nutrition. So he came up with these 14 superfoods, and they're listed here. You can get a copy of the presentation off to memorize this. But he made some claims in the book that were maybe a little controversial. He said if you ate enough tomatoes, you would get enough lycopene, which is an antioxidant, and that would essentially negate any risk of certain cancers. That's really not necessarily shown to be the case. It may improve your risk of certain cancers, but it probably doesn't negate the risk. So these foods, as you can see here, he's recommending, and it's becoming more accepted, should be the foundation of a healthy diet. All right, so moving forward, we'll maybe come back to that a little bit. But we're going to talk about macronutrients right now. So macronutrients are, the foundation of what we kind of all probably grew up hearing about in health class. You need kind of balanced carbohydrates, fats, and protein. So at least for those after spinal cord injury, we really need to think about carbohydrates and fat. And depending on where you're at in your injury, if you have a pressure sore or an infection, we probably have various recommendations in terms of how much protein you should take. So let's start with carbohydrates. Carbohydrates, as you probably know, are a quick source of energy. They increase blood sugar, leading to higher energy levels, leading to improved metabolic function throughout the body for at least a short period of time. They also supply fiber, so you need to have carbohydrates in your diet, particularly if you have neurogenic bowel. You're going to need fiber to bulk your stool, to have some sort of predictable consistency so your stools aren't too loose or you're not constipated. So you need, some carbohydrates in your diet. However, you don't need to get carbohydrates from, candy bars or white bread. Whole wheat breads are a good way to go, as are vegetables and pastas, whole wheat pastas, barley and oatmeal, not instant oatmeal, but actually oatmeal that you have to boil. Protein. So protein, as I was saying before, what's recommended for those with spinal cord injury is you get 1 to 1.5 grams per kilogram daily. So if you think about how many kilograms you weigh, if you know how many pounds you weigh, divide it by 2.2. So essentially cut the number in half. If you weigh 110 pounds, you'd weigh 50 kilograms. So if that's the case, you should be getting about 50 grams of protein. We need that protein because the building blocks of the protein that we break down are really important for muscle health, for cellular structure, maintenance, and for immunity. We get protein typically through meat, fish, eggs, egg white, beans, soybeans included, nuts, cheese, and Greek yogurt is actually fairly high in protein content. So this comes from the American Diabetes Association. So in terms of carbohydrates, one good way and one highly recommended way to think about the carbs that you take in is to at least consider their glycemic index. And what glycemic index is basically how quickly that carbohydrate will boost up your blood glucose or your BG. So you don't necessarily want these rapid swings in your blood sugar, okay? That's higher index BG foods can do that. Now, if you're diabetic and you have a blood sugar way down in the 40s, this is the kind of things that we give patients to sort of boost them immediately. But over time, the more and more of these foods in the red that you eat, your glycemic index goes up, your blood sugar swing up and down, and you become higher and higher risk to develop hyperglycemia and potentially diabetes. If you have diabetes, eating these sugars really leads to problems with your blood sugar control. So not saying, and there's no advocacy that you don't ever eat you never have a bagel again, you never have a sandwich with white bread. I don't want that message to come across, but at least consider looking at some of the lower index foods and the medium index foods rather than focusing on the high index foods. Now, I tend to eat pretzels rather than chips, but looking at it, the glycemic index is actually way worse for some pretzels than some potato chips. They're both in the bad category though. So, and I thought, eating instant oatmeal, I was being healthy. That's not actually the case. Boiling water and adding it to plain oats, you get much better glycemic index. It's a better carbohydrate to be eating. Sweet potatoes are also considered a superfood by many. And the key with, looking at these foods is the higher glycemic index foods tend to be processed more. They tend to have more preservatives in them, and they tend to be higher in terms of their sugar content. So on the left, we have more complex sugars. On the right, we have more simple sugars. So, look through this a little bit. We can come back to it because I want to sort of get through the rest of it. But think about glycemic index. Think about what you're eating in your diet. Try to have more whole wheat foods and more unprocessed carbohydrates. So moving on, macronutrients. So fat, as I mentioned before, you want the majority of your calories to come from protein and carbohydrates and the complex carbohydrates rather than the fat. Moderation obviously is key with fat. And I'm going to talk a little bit about good versus bad fats and where you might want to be focusing on in order to improve your cholesterol and prevent the type of cholesterol pattern that many after spinal cord injury get from happening to you over time. Water, between 1.5 to 3 liters of water a day is typically appropriate. If you're out on a hot day, it's going to be on the higher end. If you have a bladder infection that you're trying to flush out, it's going to be on the higher end. But you don't necessarily need to drink that much. And the balance of water is also going to have to balance with how much fiber you're eating. If you have more fiber in your diet, you're going to need to drink more, otherwise it will make you constipated. Total calories a day. So this may be shocking to some, but the recommendation from SCI Health and other publications has been pretty consistent for those with stable course after spinal cord injury, haven't been sick, you don't have an infection, you don't have a wound that's taking up a lot of protein or calories. If you have an infection or a wound, you need more calories, you need more protein to be able to sort of ward those off and to help your body recover. If you're healthy though, and you don't have those problems, you need 20 to 30 calories per kilogram a day. Again, using the example of someone who's 110 pounds, that would be 50 kilograms, and essentially you only need 1,500 calories a day. If you take in more than that, then eventually you're going to gain weight, probably gain fat. And if you exercise more and more though, you can take in more calories. So it is a balance. Okay, so good fats, so I kind of put the good fats in green here and the bad fats in yellow. So not saying you can't have any of these, but these coming from Mayo Clinic recommendations for those at high risk for obesity, heart disease, high blood pressure, those with spinal cord injury really fit in that high risk category. So good fats are things like olive oil, peanut oil, really any vegetable oil, chicken, nuts, seeds, flax seed and flax oil, walnuts. So walnuts have been really looked at as being a superfood, good source of high nutrient food that isn't processed, that has a low glycemic, relatively low glycemic index, and has good cholesterol in it. So omega-3 fatty acids are good. They also can help with your vitamin D level. They help decrease your LDL, so your bad cholesterol. They also can potentially help with your good cholesterol. So these good fats is really where you want to focus more of your diet. You know, cheese, butter, even margarine, really any snack food, so anything you may get like in a box or a bag, any chips or Cheez-Its are going to have some degree of saturated or trans fats in them. These are the bad cholesterols that can increase your bad cholesterol, and actually some of them can actually decrease your good cholesterol. So it's sort of a double whammy in terms of your blood vessels and your overall cholesterol health. So I'm going to move now from the macronutrient category to the micronutrients. So this is, again, the vitamins and minerals. And I'm going to talk about those that are relevant in spinal cord injury and also the ones that have been kind of studied in the general population. So vitamin A aids in formation and maintenance of skin. So not uncommon to use like vitamin A cream if you have just had a surgery to prevent a bad scar from forming, but also you get it in your food. It can also help with vision, as can vitamin E. So these are typically found in high concentration in dark green and yellow veggies, as well as milk and egg yolk. Okay, so if you get enough of those in your diet, you're going to probably not be vitamin A deficient. Vitamin A deficiency isn't as rampant as vitamin D deficiency, we know that. Vitamin B12 is very critical for nerve function and actually cell function, particularly red blood cells. So if you don't have enough vitamin B12, you can become anemic and have low red blood cell concentration, become very fatigued, and have low energy. So you get vitamin B12 from meat, and supplementation is controversial right now if you have a plant-based diet. There are many that think that you get enough vitamin B12 from certain types of fortified foods in a plant-based diet, and certain vegetables do have some degree of vitamin B12 in them, particularly those that grow from the ground. However, they've been challenged that it's not enough. Red meat is particularly high in vitamin B12 concentration, so having a little bit of meat in your diet can be good for your B12. Vitamin C is helpful, particularly if you have a wound, so it's helpful for collagen synthesis. Collagen is structurally important for skin health and soft tissue health. So when you have not enough vitamin C, it's hard to heal up a wound, hard for muscle to grow over a wound, hard for bone to heal, and hard for skin to heal. So increased vitamin C is recommended, particularly if you have a wound that you're trying to heal. Can be found, obviously, you guys probably know this, in citrus, peppers, broccoli, and also in green veggies. Other micronutrients, again, iron is very high in content in any vegetable that grows out of the ground. Also found in meat and poultry. Found in fairly high concentrations in fortified cereals and foods. If you do supplement, you should take it. If you do take an over-the-counter supplement of iron, you should take it with vitamin C. Otherwise, it's not absorbed very well. So you need to take iron with vitamin C to actually get the most out of the pill if you take a multivitamin or just an iron supplement. Folate is critical for cellular production, DNA synthesis. If you don't have enough folate, you struggle in terms of nerve function and a variety of other organ systems. Green leafy vegetables are very high in folate. If you're on Coumadin, a blood thinner, that's fairly common if you've had a blood clot. You have to watch out, though, because all of a sudden just throwing a lot of green leafy vegetables in your diet increases your vitamin K, which then decreases your INR and makes you take more warfarin. So, you know, moderation for a lot of these things is critical. That you should have some of them in your diet. I want to come back to this point because fortified foods in the United States has been looked at. There is some evidence based on one of the leaders in vitamin D research out of Harvard. He actually went out to the grocery store and just bought a bunch of food, and he tried to see how much vitamin D in particular there was in all types of milk. And he found in his laboratory that less than 50% of the milk he sampled had half of what it reported on the label in terms of vitamin D. So the United States has become more lax in terms of USDA regulations, it seems, through some of this research, and actually checking to make sure that different types of vitamins in these processed foods and in milk are actually there. In Canada, they're actually much more strict on this, and maybe because they've known about vitamin D deficiency much longer, their patients live at a higher latitude, so they get less sun exposure. So they've known they've been deficient in vitamin D for much longer than we have in the United States. It's been a much more hot topic here over the last 5 to 10 years. So anyway, fortified foods, I think you got to kind of take that with a grain of salt. Part of the recommendation and part of the strength, I think, in a plant-based diet is you're getting a lot of these micronutrients if you follow those superfoods and incorporate them into your diet, and you kind of minimize some of the processed foods. You had a question? Yeah, I can. So iron is actually, so the question was what I meant by the top line, which is hemoglobin production in red blood cells. So iron is actually a cofactor in hemoglobin. So without iron, your body loses its hemoglobin stores or cannot make hemoglobin, depending on where you're at. If you just had a big surgery and you've had blood loss, if you don't have iron in your body, you cannot create hemoglobin. Does that make sense? Okay, good question. So hemoglobin is the main part of red blood cells. So hemoglobin carries oxygen throughout the body through the red blood cell. Red blood cells transport oxygen to different tissues all throughout the body that we need to function metabolically. Does that make sense? So we breathe in oxygen. It gets taken up through the capillary system, the small vessels in the lungs, by hemoglobin in red blood cells. Without hemoglobin, we cannot really use the oxygen that we're breathing in. So we develop anemia or low red blood cell counts if we don't have enough iron to synthesize or create hemoglobin in red blood cells. Does that make sense? Okay.
And just to clarify, you said that taking vitamin C, taking iron in order to reduce the glycemic rate. But if you're, and then you said something about if you're taking a multivitamin that has vitamin, the multivitamin has vitamin C in it.
No, that's a good question. So some patients, depending on if they have anemia, are on iron. It's a very common supplement that gets prescribed to patients. And they may also be on a multivitamin to sort of meet some of these other micronutrient needs. In that case, you would want to take vitamin C with the iron. Does that make sense? If you're on multivitamins have a variety of concentrations of things. So if you're on a multivitamin that's high in iron but low in vitamin C, it would be advised to take maybe an extra vitamin C tablet. The low tablets in strength are like 500 milligrams. Okay, so vitamin D is also a micronutrient. We've talked about some of the others. Vitamin D, it's gotten a lot of attention. This is the physician and researcher I was talking about out of Harvard, Michael Hollick, this is a very interesting book to just sort of think about vitamin D deficiency and why it's happening in the United States. I'll talk about the general population and specifically in California, seemingly high-risk patients, and I'll talk about spinal cord patients that are even higher risk. But vitamin D's got a lot of attention. It's been shown potentially to improve autoimmune disorders. It's been thought to be preventative in terms of certain cancers, particularly colon cancer, and within colon cancer, definitely within those who are African American. There's also some evidence, although controversial right now, that normal levels of vitamin D in the blood can decrease breast cancer risk and prostate cancer risk. That hasn't been accepted throughout the medical community. However, there are studies that are accepted showing that at least in adult males and the general population, low levels of vitamin D increase heart attack risk and general death. So if you have a low level of vitamin D, less than 10, severely low, you have a higher risk of death than your counterparts, controlling for all other known causes of death, including cancer, heart disease, and others. So that's actually based on very large population data throughout the United States. So there's reasons to be on vitamin D other than what I'm going to talk about, but it's interesting nonetheless, so I'm going to talk about it. So classic physiology, just basically, we get vitamin D from the sun and also from certain foods. So sun exposure converts a subtype of cholesterol, 7-dehydrocholesterol, into a pre-form of vitamin D3 in the skin, which is then converted into vitamin D. You can get vitamin D through different foods. I talked about fish. So fatty fish is very high in concentrations of vitamin D. Fish oil, if you take an over-the-counter fish oil supplement because you're on omega-3 fatty acid supplementation to help decrease heart attack risk and stroke risk, it's actually very highly concentrated vitamin D. So you kind of get two things for one in terms of that supplement. But you do get it from other foods other than what I've talked about. Milk and dairy, I said it's controversial whether or not you're getting what the label says. It's then converted through a few different processes in the liver and the kidney into an active type of vitamin D. And this vitamin D, we thought, throughout time, it's really only critical to increase your calcium and phosphate absorption from your stomach and your colon, and also to improve our bone strength. So if vitamin D is not around, another hormone that kind of balances it out, parathyroid hormone, continues to pull calcium and phosphate out of the bones, and you develop osteoporosis. So low levels of vitamin D in spinal cord injury, you're already losing a lot of bone density because you're not standing on your legs typically, depending on your level of injury and how complete it is. You're not, you don't have muscular forces, torsional forces on the bone, and we know that increases bone density. So when you lose those two components, you don't want to lose a third component and have your bone density even worse, increasing your fracture risk even more. So vitamin D, if you get enough of it, you can maintain bone density, provided other factors are also stable. So sun exposure. This is kind of interesting, but I may have talked about this last year. I'm sorry if I'm being repetitive here, but they did a study actually looking at skin protection factor 8. So that's like what you get in like hand lotion or face lotion. It's not what you would put on your skin if you were going out on a sunny day and worried about getting sunburned. And just that amount of skin protection factor competes with UV radiation enough that you don't really get any significant benefit from sun exposure in terms of your vitamin D level. So it decreases your vitamin D synthesis by 95%. You can imagine if you put on like 30 or 50 or 80, like my sister-in-law does, who's a dermatologist who lives in LA, and she puts, zinc on like all the time. But so African Americans need a lot more sun exposure than lighter skinned individuals because the melanin content in their skin is higher. That also competes with the UV radiation and doesn't allow the conversion process to happen to form vitamin D. So if you have darker skin and or if you're wearing a lot of sunscreen, really sun exposure is not enough. Now, what Michael Hollick, this guy who's probably, again, the leading kind of expert on vitamin D in the United States, I would say right now, what he's recommending is at least 15 minutes a day of direct sunlight. He found that in patients that in Boston on sunny days that went out wearing, I think, shorts and T-shirts, he looked at their vitamin D stores before and after and found that you can actually get as much as 20,000 units of vitamin D, which is a lot, just by getting 15 to 30 minutes of sun exposure a day. Now, he put that recommendation out there, and you can imagine the dermatologist said, what are you doing? You're going to increase skin cancer rates. That's, unethical. You shouldn't be doing that. People are going to go out and forget their sunscreen, and then they're going to be higher risk of melanoma. I think the truth is probably somewhere in the middle. I think if people are responsible and get a little direct sun exposure and then put on sunscreen if they're going to be out longer, it's probably the way to go. But, the dermatologist may be right in thinking that some people could forget. There's also, I mentioned, sort of a role in autoimmune disease with vitamin D. Vitamin D receptors have been found many places, not only in the gut and in the bone like we thought before, but lately we found them, almost everywhere. And research supports these findings in high contents in the nervous system, particularly the brain, spinal cord, muscle, heart. I talked a little about heart disease, blood vessels. They're essentially ubiquitous throughout the body and found all over the place. So vitamin D acts not only as in terms of metabolic function, in terms of raising your calcium absorption and maintaining bone density, it also affects genetic function and transcription throughout all organ systems. That's what we're finding out. So this is sort of why I got interested in this research, because it became pretty clear to me that the population of patients I was typically dealing with, those with spinal cord injury, have high deficiency rates of vitamin D, much higher than the general population. So Bauman, Bill Bauman, who's an endocrinologist and so a diabetes expert and a spinal cord injury expert, he's on the East Coast. He's published a lot on this, but he found that a third of patients in the chronic PH setting had very low levels. So anything less than 30 is low. And he's finding a third of patients had levels severely low. Majority of patients by Greg Pneumonitis in Ohio, just on acute rehab, 90% of patients or more had low levels of vitamin D, and 20% of them had severely deficient levels. So this is a category of heart attack risk and general death risk if nothing is done about it. 2/3 of the rehab outpatients and about the same in Chicago by Pelican were found to have low levels of vitamin D, and those with spinal cord injury or traumatic brain injury were highest risk. So this is sort of comparison data. I've followed now, I have data on, I think, 250 patients who come through our unit over the last few years. And what we found is about 70% of them have levels of vitamin D between 10 and 30. So low, but not severely low. Now, if you compare that to our typical demographic, we see more males and females, and typically the age range that we see is between 20 and 60 years, although we see younger and older. But just looking at that subgroup in the United States, you can see that about 40% of U.S. men, white is still our most common demographic, although it's pretty close with Hispanic and Asian right now. But just looking at this demographic, you can see that only 40% versus 70% had low levels. And if you look at the severe deficiency, the really low levels, there's only 2% of this population had levels less than 10 versus 13% of our patients. So severe deficiency in over 5 times more than the general population, sort of matched cohort or matched population. Now, I also looked at a big study done by Blau. He published this on California women osteoporosis. So he looked at women in California osteoporosis, looked throughout Northern California and Southern California and checked their vitamin D levels. And he found that these women actually, their vitamin D levels, although higher risk than the general population, you can see it's significantly less than those with spinal cord injury acutely. So between 40 and 50% had low levels, but still only like 4% had severely low levels. So those with spinal cord injury, even compared to other higher risk groups, are significantly lower in terms of their vitamin D and higher risk for potential problems associated with vitamin D deficiency. So some of the benefits of vitamin D deficiency, I want to kind of fly through this because I want to get to the rest of the talk. Plotnikoff published that pain is common in non-spinal cord injury patients. Mood has been studied a lot, showing that patients with seasonal affective disorder, if you replace their vitamin D, it's actually better than sun exposure or light box exposure or prescription of medication. They do better in terms of their mood outcomes. Wilkins found vitamin D deficiency linked with depression in older adults in the United States. Strength and bone density also tied to low levels of vitamin D. So we've been doing a study, and I got grant funding through the American Spinal Injury Association to do study on this. We're not quite done, but essentially we looked at vitamin D replacement in patients with spinal cord injury, both on inpatient rehab, starting there, moving forward, and also those who are 2 years out from injury, so the acute and chronic population with spinal cord injury at Valley. So we looked at our main outcomes we were looking at were pain, mood, fatigue, and strength. And also, there's no clear dosing guideline for anybody with vitamin D deficiency in the United States. People are doing a lot of different things. So I was comparing a lower dose strategy to a higher dose strategy, both of which are fairly commonly used. I'll skip through this, but just briefly, what we did was we prospectively followed people, so we enrolled them after the vitamin D level is low. If they wanted to participate in the study, we enrolled them, followed them for 6 months. We looked at their vitamin D levels at 1 month, 3 months, and 6 months. And we also looked at pain, mood, fatigue, and strength, and looked at the measures, see if things were improving as they got vitamin D replacement. So here's the age, pretty common. Average age in the United States of spinal cord injury right now is almost right at 40 years, and much more common to see males and females, which is what we saw. 80% were males, 20% were females, both in the acute and chronic group. As I was saying before, we're still seeing more Caucasians in the acute setting, but this is pretty well mixed, actually, compared to a lot of other rehab centers throughout the United States. Hispanic, as I said, Asian, and African American. And as you can see, a little bit more Hispanic in our clinic than the other demographics, so a little bit more heavy in terms of Hispanic. Weekly sun exposure, briefly, 70% of the acutes and almost 55%, 54% of the chronic patients were getting less than 5 hours of sun exposure a day. Now, oftentimes patients after spinal cord injury may feel colder, so if it's a cold day, they'll be bundled up. Essentially, they're not going to get as much sun exposure, therefore they're not going to get as much benefit from the sun exposure in terms of optimizing their vitamin D level. So what did we find in terms of bad problems? 2 people out of 40 that were enrolled had constipation. Now, whether or not that was due to the medication or the vitamin D supplementation or due to just their neurogenic bowel fluctuation is hard to say. One of the patients did have a fracture. He was ambulatory and decided he didn't need to use his crutch when walking out to get lunch at a food truck from work, and he fell down, unfortunately, and he broke his hip. He had a really good outcome, though. It was a clean break. He had an operation, and he's actually doing better than he was before. There was 1 kidney stone in a patient who we screened. They hadn't even actually started the vitamin D replacement. So you can see these are the initial levels. They're fairly low. So what happened over time with the patients that were in the study? It's really hard to see this line, so I apologize for that. So the treatment groups, so I can make sure I'm right, are the blue and the yellow here. So you can see they started off with low levels of vitamin D, and they actually improved more over time. So these are patients that are on higher doses. They were on essentially between 2,000 and 4,000 units of vitamin D a day versus the control groups that improved less over time were on lower dose of vitamin D. So did that make any difference? So this was actually significantly different. 800 was less effective than, you can see there's a big increase. It just so happened that some of the patients initially in the control group through randomization had higher levels of vitamin D. So this is depression. So you can see depression scores. These averages at study outset initially were actually in the mild depression range and improved to the normal range. So that was a significant improvement, whereas the chronic patients did not have significant changes. Fatigue improved. If you looked at the combined groups, so if you combine the acute and chronic groups that were on higher doses of vitamin D, they improved more over time in terms of their fatigue scores than did the lower dose group. We also looked at strength. My hypothesis was that in a chronic spinal cord population, we replace vitamin D enough, you may see some strength improvement. It's hard to say for sure if that's happening. We had, relatively low numbers. We have 40 patients total, 20 of which are an outpatient group. You do see some increase here, but it's not statistically significant because we have a lot of outliers. So if we get more patients enrolled in this study or pursue this further, we might be able to say more. We'll skip that. I want to talk a little bit about exercise. These are the guidelines for exercise right now through the federal guidelines and the American College of Sports Medicine for those with disabilities. The recommendation is 150 minutes a week of moderate intensity aerobic exercise. So that's defined through these metabolic equivalents and the board rating of perceived exertion. It's hard to say, within the different types of activity, even wheeling a manual wheelchair around the community, whether or not you may get more benefit, or where, in terms of the intensity level, you get your benefit. It hasn't been studied as much, so we don't know in terms of that. We do know, like, walking versus jogging versus swimming, there are gradations of the intensity of the exercise. It's also recommended that those with disabilities, if they can, perform some weightlifting 2 days a week to maintain muscle mass. So this is maintenance. As I put on the bottom here, this is actually just to maintain what you have rather than improve. If you want to improve your conditioning or your strength, you need to do more than this. So the guidelines actually aren't that much different than the general able-bodied population. Exercise options, wheelchair sports, wheelchair basketball, and I know quad rugby. I know through the SCI Connections and I know through the peer support group, you guys get exposed to these as potential activities that you might be able to participate in. I'm going to talk about functional electric stimulation because it's probably not something all of you know about, and it's become more commonly accepted as a viable form of aerobic exercise in patients with spinal cord injury. How many of you have tried FES? So several of you. Okay, so maybe about half. So this is essentially using electrical current through electrodes that are placed just through adhesive onto different muscle groups. The basically auxiliary nervous system contracts, sending current down to muscles, contracting the muscles, puts the body through certain types of motion that can be functional and can improve aerobic exercise. been studied and improves stroke volume, heart rate, and oxygen uptake. All of these are associated with the same type of benefit we get from able-bodied exercise. So if you do it enough, it can be beneficial. I'm going to play a brief video, or at least part of a video, showing FES. This is Stephanie, one of the PTs at Santa Clara Valley. So this is one of the devices. This is I think it's called the R2-200, I believe. And as you can see, you can transfer into it, and then you can rotate the seat over. It is more of a stepping motion than a true cycle. There are FES cycles as well that can put you through. That's probably the most commonly used FES device right now in the United States. FES rowing is being looked at more and more, particularly for those that have trunk control. FES rowing is a feasible option, something that we're looking at getting a device at Valley. For those with cervical level of injuries and those that don't have a lot of even upper body control, you can still use this machine actually. So you can strap in. If you don't have trunk control, you're still stable in this. Stephanie is only putting the electrodes over the quads here and through the back on the hamstring. So essentially the quad's kicking the legs out and the hamstring is pulling the legs back. So extension and flexion, alternating those movements on opposite sides of the body. And this patient has the ability to this machine can do that and provide some aerobic activity and exercise for those with even cervical levels of injury. What she's doing now is she's controlling the different degree of stimulation through the different electrode channels. You saw a little bit on it. I'm gonna they have to play more of it in a bit. You can see he's exercising. Recommended to maintain cardiovascular benefit and actually a bone density benefit that you may get through this. You have to do it regularly. If you stop, you really lose the benefit very quickly. So you need to do this. If you're going to keep up on it, at least 3 times a week is a recommendation in terms of aerobic support. So other wellness activities that we've done some research on through Valley. Tai Chi. Any of you been involved in the Tai Chi with Dr. Shem and Paul Carafel? Okay, great. I'm going to scan towards the end. I'm not the expert on this. Dr. Shem definitely is. But what you looked at is Tai Chi, I believe it's pronounced, and then Tai Chi mini sets. So even if you're in a power chair, you can participate in some of these movements. What's interesting about Tai Chi is not only its potential benefits in terms of psychologically and on chronic diseases and disabilities, but the other benefits. So it can improve strength, it can improve balance and coordination, sleep, and it's actually a moderate intensity cardiovascular exercise. You wouldn't think Tai Chi a lot of times seems like more meditation, but it actually increases your oxygen consumption quite a bit and is a viable form of activity for those with spinal cord injury. So I'm going to cut to the end. These are different pictures of groups that Dr. Shem was following in a research study. She had 25 patients enrolled. And what she looked at is the before and after. So baseline versus being involved in a program of Tai Chi. And what she found was significant decreases in pain, sense of well-being improved, sense of spiritual connection improved, as did mental distraction, or your ability to sort of distract yourself from stressful situations. Wheelchair dance is something that Dr. Masters, one of the residents at Valley and at Stanford, is studying with Dr. Clara at the VA. And just briefly, they had patients, 7 with paraplegia and 8 with tetraplegia, go through training. 5 were power wheelchair users and 10 were manual wheelchair users. And what they found was significant improvements in range of motion, strength, coordination, 6-minute distance of propulsion of the wheelchair if you're a manual wheelchair user, and also improvements in obesity or weight, pain, and reaction time. So a lot of actually significant findings out of that study, which I believe is still going on at this time. So these are pictures of, I'm not advocating this, just to go on record, but if you're interested, this slide has an article that talks a lot about wheelchair dance. And I know that there has been some interest in the community for that. I don't know if anyone here has been involved in that. But I've asked them? Okay. Those are my highlights. Just to summarize, again, after you're higher risk to develop the metabolic syndrome, which is high blood pressure, abnormal cholesterol, obesity, and essentially being higher risk for heart disease, as well as, I think I mentioned hypertension or high blood pressure. High glycemic index foods or simple sugars or processed foods you need to be careful of and try to minimize in your diet. I need to minimize in my diet, so I'm not necessarily on a soapbox here. But good cholesterol foods should be sort of optimized in the diet rather than bad cholesterol. Now, you shouldn't just go out and eat guacamole all day long because avocados are in there, because it's still very high in calories. So you have to look at the calories as well as the fact that it's a good fat. So they're calorie rich, but also nutrient rich, and just got to be careful. Micronutrients such as vitamin D are important for health and lacking in the average diet in the United States, and exercise is important. Although there are limited options after spinal cord injury, there are options out there for most of you. These are some references, and that's it. So it's more like 50 minutes. I apologize for sort of running over. I had just kind of gone through it in my head a little bit today. But you guys have questions? Yeah. Good question. So whole milk, yeah. So the question was, I think the question, if I'm interpreting it right, is which type of milk probably has the most vitamin D? Is that the, or what would I recommend? Yeah, that's a tricky question because of Michael Hollick's research. He sampled different types of milk. And again, he found that a lot of the milks, including vitamin D milk, had less than what it reported to have on the label. So what I would recommend is low-fat milk. I think there is some vitamin D benefit there, but I don't think it's enough to maintain your, or even optimize your vitamin D level. What I would recommend for essentially anybody that has had a spinal cord injury is that you should be taking 2,000 units of vitamin D at least in addition to your daily diet. I think unless you follow a strict plant-based diet, and even if you do that, it's not clear that that's enough in terms of that one micronutrient that we know is severely low. So until I know more, that's my recommendation right now. Yeah.
So meat is a tricky thing because it's got benefits for protein and iron.
Mm-hmm.
Also got fat.
Mm-hmm. Mm-hmm.
How do you balance it?
I think that's a really good question.
How to balance food?
Oh, sorry. The question was, meat and dairy. I think you mentioned just meat. So just meat. I think you could add dairy and actually cheeses into that comment. But the question was, how do you balance out the potential benefits with some micronutrients like vitamin B12 and also macronutrient like protein with the fact that, meats, if eaten too much, to high bad cholesterol, high blood pressure. I think moderation is key. I'm not necessarily advocating that you become a strict vegetarian. I think that having moderation of red meats, poultry, or chicken, and turkey. Turkey is actually listed as a superfood because it seems to be lower in some of the bad cholesterol as compared to even chicken. It's also lower in caloric volume and glycemic index. So it's a relatively healthy meat that has more B12 than other potential options for vegetarians. But strict vegetarians, most of them can get enough B12 through modifying their diet enough, using different oils and different fortified foods with B12. However, I think red meat in moderation is fine. I think fried red meat or processed red meat is the problem. If you go to McDonald's, that red meat is not going to be the same as going to the grocery store, buying a steak and grilling it. Lightly grilling meat rather than dousing it with butter, using maybe an oil to cook the meat in is recommended. Yeah. Mm-hmm. Yeah. So the question was from Mark Tuttle asking that he'd had a physician advocate for omega-3 supplement. So that's a good supplement to take, and omega-3 fatty acid or fish oil supplement is very high in content in omega-3 and also high in vitamin D. So it's sort of, like I was saying a little bit in the presentation, that's a good supplement. If you're going to look at supplements, that's a supplement that has some substance behind it and some evidence behind it. So it can help with your good cholesterol and also can lower your bad cholesterol. So that's a good recommendation.
You mentioned the thyroid. I think mine up
You said thyroid?
Yeah.
Yeah. I mentioned parathyroid, which is similar. The question was, how does thyroid function factor into this? So it's a good question. Now, those with spinal cord injury aren't necessarily higher risk to develop hypothyroidism. That's not clearly supported by the evidence in the literature out there. But if you do have low levels of thyroid function, it decreases your metabolic rate. It leads to higher obesity. It leads to cardiovascular risk. It can lead to low heart rate. So there's consequences of low thyroid I didn't get into that I don't think you can necessarily fix through diet. Yeah. Low thyroid function, you really need to be on a medication to fix that problem. Yeah. Yeah.
I saw Dr.
Uh-huh. Yeah.
And today called me.
I can get your name and I can look it up tomorrow when I go into work and give you a call. But the question was, someone here had a vitamin D level checked by Dr. Shem and was wondering if his level was normal. I don't know off the top of my head. So we're actually routinely screening people because depending on how low you are, you may need even more than 2,000 units a day. In fact, what we're doing is putting people on 50,000 units a week if your level is essentially in the low teens or below 10. The endocrinologists, the specialists in sort of nutrients and diabetes and all that have sort of become more consistent in their recommendation, but still variable. So what we're doing is repleting vitamin D levels pretty aggressively because we know that they're associated with higher general risk problems. And also through our research, it seems that fatigue is impacted as vitamin D level goes up. You have more energy, and you may also have less difficulty with decreased mood. So, yeah. Question?
So, this is an amazing presentation in terms of the data that's relevant to us. As I think about the new spinal cord injury patients to the hospital, and this is a matter of things that they need to worry about on a daily basis, and how to balance it. What would you recommend to patients in terms of how to be able to get their arms around this really important topic while they got bladder stuff or respiratory this, that, the issues that they have to constantly worry about?
Yeah, and this is something that I've gotten more and more interested in over the last few years because we give patients a lot of medications, especially in the hospital right after injury, medicines for pain, for bowels, sometimes for bladder, for skin health. And, before you know it, you're on 10 to 12 medicines, and, we're trying to really limit that. And I think a movement that at least I'm trying to push in our group is to use medicines less and less, use medicines that really work, that we know are helping patients, and don't discharge patients home on medicines that we're not sure had a significant effect in the hospital. Sometimes we just add and add and add and add. And I think, Franklin's question was, how do we balance out all the issues that someone who's just had paralysis through a spinal cord injury, all that they have to think about, and add in something like this, talking about nutrition and optimizing that? I think it's a tough question. I don't have a simple answer to that. What I would say is we need to be better in terms of the food groups that we offer, and maybe as rehab gets towards the end, having more education. Our nutritionists come around and do a fine job, but they don't focus and go into details on a lot of these things. They may come by when someone's in the gym and, meet them and make a couple of notes, but they don't go into details. So it may be something that we need to add to the formal SCI education that we have in the hospital that rotates every 3 weeks. And I think certainly through, peer support group efforts and SCI Connections, we can, reinforce it by maybe not having pizza next time, maybe having something else. But
way to go, Robert.
No. I mean, yeah, moderation is critical, but I think we have to all be sort of stewards of that. And as people come in to sort of meet patients who have just had injuries, talk to them about healthy living, that we're all kind of learning about. I mean, I don't consider myself an expert in this. I think it's something I have an interest in. I would love to get the cafeteria to a place where we can actually do more of a plant-based diet for patients so that they don't have to go down the street to Trader Joe's. Their family doesn't have to go out to get food that's tasty and healthy. We should be pushing that in the hospital rather than focusing maybe our finances and monies other places, because it can be effective even just after an injury.
as a family, as far as when you're both working and you're busy, trying to make choices as far as, you know, grocery store and food time.
Yeah.
There's definitely stuff that than it is that we need to go to. So it is a challenge trying to be able to pull it off and pull it out of the week and maybe be so good as you should have, or program is so well done that it's really easy. Sometimes it's frustrating as a hassle. Other times it's pull it off and more. So definitely did hear this information again and kind of refocus on what we need to do to make sure.
Sure. A pleasure.
So one of the things that we talked about at the beginning, which is, you know, obviously most people get is the idea that, you know, energy and out.
Yeah.
So the dietary component is obviously the food every day, regardless of what else is going on. But you don't necessarily exercise every day without you just sitting around functioning. So looking for ways to increase exercise and increase activity, I think, is a challenge for everybody, with the body and really. One of the activities that I noticed is not something that is swimming.
Yeah.
Is that something that is not necessarily as effective, or is it just that it was?
I only mentioned a few things. This is not meant to be comprehensive. I was just touching on some things. I wanted to talk about FES, because functional electrical stimulation, because it's something that is being recommended more and more, and really from a physician perspective, it's something that, you know, we have to screen patients for. The question was, what about swimming, essentially, and is that an effective way to get aerobic exercise? Yeah. And given that it can be one of the easier things for a person to be able to do, I wondered if it's not, the payoff isn't as good. Yeah. So, again, whether or not swimming is effective and the payoff of it is as good as something else, I can't say that it's as good as anything else. It hasn't been studied. And it really depends on I think, the level of injury and how much motion the patient is able to do, or the person is able to do in the pool. Now, if they have some upper body function, they're definitely getting some aerobic benefit and anaerobic benefit, because the good thing about swimming is it's sort of like the perfect exercise for people. It's low impact in terms of the able-bodied population. It's low impact, it's high aerobic, and there's anaerobic benefits. And it's very safe, right? At least for patients, people who can swim. So I think there is a benefit. It remains to be seen how much, but it's certainly something that if someone can participate in, it should be considered. And again, the recommendation for those 150 minutes, they can be spread out. You know, the recommendation is to have at least 10 minutes in a row. So if you're a manual wheelchair user and you're pushing yourself around the mall and you're going from one end of the mall to the other and it takes 15 minutes, that's aerobic. That counts towards your 150 minutes. Now, if you're going room to room and it takes a couple minutes, that doesn't really count for a cardiovascular benefit. And obviously, it's harder for patients who have higher levels of injury that use power chairs. But FES is probably the answer for those patients, trying to get them involved in that kind of a program. Swimming, though, could actually help. It can also help with range of motion. So it's definitely a good activity. Yep. Yeah. Yeah. There are home units. They vary in price. They vary in efficacy. So there was a comment from Deb who mentioned that she has a home unit, and I think there's a few others. I think Rich has a home unit. You want to comment on what your thoughts are? Yeah. There's all the benefits of the way you go afterwards. Sometimes the inhibiting, yeah. You can also record your calories, the amount of calories you're burning, or no, I'm not. Okay. I remember you telling me one day. And you said you were, so Rich is a para who has a FES cycle, right, at home. and he was mentioning that, you know, in addition to what I had put on paper, FES cycling for him, he feels, you know, like he's getting a really good workout, he's sweating and just feels better and energized afterwards. He's able to see that his heart rate goes up for the people out there on the web. And then you also mentioned that how many calories do you think you burn through like a session, and how long do you go for? So 60 minutes. That's actually a very long time. That's impressive. And then how many calories? So 400 to 500 calories. So that's, you know, vigorous exercise. Even if you did 30 minutes, you know, and did 200 to 300 calories, that would be extremely good. You know, you're talking about 3 times a week, that's 90 minutes. The FES cycles are expensive though, the ones like Rich has. I'm not sure what you have exactly, Deb, but the FES cycles that have been studied are in the realm for a new one of like $10,000 to $12,000. They're not covered by insurance now. There are places in the community that you can go to use them for a fee, and we're in the process right now at Valley of starting an after-hours therapy program where patients can, you know, anyone can come in and use the equipment we have at Valley with supervision. So that's something we're working on building. Hopefully it'll be starting up in the next few months. We have to jump through some hurdles with the county, believe it or not, Carl. We have to jump through hurdles with the county to get that going, but we're dedicated towards it. So we have several FES cycles. We have the FES stepper, and we're looking at getting an FES rower by the time we're in the new building about a year from now.
I've got a question here.
Yeah.
It says, is Swiss cheese an okay food if it is made from low-fat milk?
Yes. So the question is Swiss cheese an okay food? It's an okay food. It is a cheese, so it's an okay food to have in your diet in moderation. Yeah. Another question? Okay.
Regarding meat, because, you know, oftentimes we think that
Right.
and so I think when I look at the guidelines, it's only talking 3 to 5 ounces of meat in eat. And when you're talking red meat, different red meats are processed in the body differently. So lamb blends up the body really well as sort of goat. So our body in the process, about 85% of that is about 15% waste, if you will. And when you drop it down to beef, you're talking 55% processed by the body, so you've got 45% waste. And for the pork, you can drop down more. So I'm not sure what it's fitting in. But so it's kind of putting with what you do with the food. And in terms of milk, what I said of bone loss and that kind of thing, when milk comes out of a cow, it's often. And this is processed to the pasteurization, it's forced into it. So if you're drinking a lot of milk, your body has to process the acid out of it. If you can, you don't have to really get raw milk very often, unless you know somebody who has fat. Goat milk is, again, more a body more receptive to goat and sheep. So we're closely related to the residues in the other cows. That's just the real efficiency that we're looking at. In terms of how you prepare the food, well, it's like, you know, I mean, I think it's better to plan, but I'll take like 2 hours. Oftentimes I'll set my laptop computer in front of me and have a set conversation with everyone doing it. And I'll take like a whole head of broccoli and I'll just, you know, chop it all up and prepare it. And I'll just do a whole bunch of stuff. And then it makes it really simple to toss it into a steamer, or to toss it into a salad, and do that kind of stuff so I can get the whole veggie thing. And quinoa is a whole protein grain. So you get protein from that, which is really different than if you're looking at brown rice. So that can go on further to your skin, to your onion, and your chocolate vegetables, and you have a complete meal just in that, in those 3 or 4 items. Makes it pretty simple.
There is a long comment by someone who probably should have given the talk rather than me. One thing just to tag on. Oh, there's a question. Okay. Oh, good point. Yeah. Yes. I was not behind that. That was Chris Wilder and the Valley Foundation, but there's a comment from an audience member about the farmers market. There's a farmers market every Wednesday around lunchtime, right? I'm not sure exactly, 10 to 2. So, sometimes farmers markets, I think it's great that we have a farmers market. I hope that the prices are reasonable. Organic versus inorganic vegetables. What are the, nutritional, what is the nutritional value? They've actually looked at this at Stanford, and it's unclear that organic vegetables or fruits are actually any better for you than non-organic. So the problem is the benefit is non-organic fruits and vegetables are cheaper and easier to make because there's a lot of pesticides and other byproducts that are used from the agricultural perspective to be able to generate a good harvest. However, if you scrub your vegetables down and wash them and soak them and rinse them, you probably are getting as good a nutritional value for a lower cost than you would be if you focus on all organic vegetables. I'm not saying there's no benefit to organic vegetables, but if you look at cost, it's unclear that it's necessary to be spending all your money like Whole Foods or at farmers markets. There are some good buys at farmers markets, and I think it's great that we have it at Santa Clara Valley, and I hope that it's utilized.
There's one question here online. It says, is there a blood test for vitamin D deficiency?
Absolutely. Yeah, so we are, if you come in clinic and see one of us, we'll probably run the test on you. The question was, is there a lab test for vitamin D deficiency? And that's kind of what I was blowing through in the slides there, but we've shown pretty clearly that we can improve the vitamin D level to normal through the higher dose replacement strategy, essentially 2,000 units a day. If you are vegetarian, vitamin D3 comes from irradiated sheepskin, actually. It's concentrated, and that's how they make the pills, essentially, is through irradiated sheepskin. So if you're a strict vegetarian, you can take vitamin D2 and focus on fish oil because it's high concentration of vitamin D and get the same benefit. Just FYI. Yeah.
I read somewhere that the pesticide goes into the soil and get into the vegetables from the inside.
I'm not an expert. I think so. The question was, can you rinse all the pesticides and problems away from non-organic vegetables and foods that aren't made? So there's balance now. There are foods that aren't organic, that aren't exposed to certain pesticides and certain hormones. So if you go to the grocery store now, it's a little bit more complicated. You see different labels on foods, whether or not there's hormones involved in the production or other artificial means. So I don't have a great answer to that question. I think I can't sit here and say that you won't get any potential chemical in your body if you take that non-organic food. But if you're cooking it and you rinse it off, most likely you're getting a good nutritional benefit without a deleterious, effect from the way it was grown. Question.
All kinds of data. There are a lot of vegetables and a lot of fruits and problems that are commercially grown and are not grown in the plant. One of the things that is highly toxic is you can't wash it out of the strawberries, the blueberries, the raspberries, all those candies. It's really challenging. They're toxic. You can grow in commercial way, but they're not really healthy and they are a calorie. So for me personally, I Like avocados and problems, doesn't matter whether it's commercially done. Pineapples doesn't matter. There's new rules. There is a new clear information that is one that pretty much onions no problem. Yeah, it really doesn't.
So I want to just kind of refer you again to these websites. There's a handout material here that comes from SCI Health, talking about kind of healthy considerations for cooking food and choosing food. So consider that.
Thank you again, Dr.
Thanks. Sure.